Hello, we're going to be talking about EKGs today, also known as the ECG, which is short for the electrocardiogram. The electrocardiogram is a test that measures the electrical pathway and the activity in one single heartbeat. When taken over time, we can see a clear description of what is going on inside the heart. This is done because the electrical pathway runs through every tissue of the heart. Therefore, if there is a piece of the heart that is damaged or something else as a chemical imbalance that is causing interference with the electrical pathway, the actual integrity of the heart will be compromised. And this can be seen on the ECG by a trained professional. So in order to understand the electrical pathway of an ECG, we need to review our anatomy and understand what the heart's relationship between the cardiac contraction and the electrical pathway. My friend here will bring me the heart. This is the heart. As you see, right now we have the apex of the heart in the bottom, which is the lower ventricles, which will be facing a human body as such, going towards the left. The heart is slightly on the left side. So if we open up the heart, we now see our right atria, our left atria, right ventricle, left ventricle. The electrical pathway starts up here on the top right corner of the right atria. This is called the sinoatrial node, also known as the natural pacemaker of the heart. The electrical impulse starts here and it travels, which stimulates a contraction in both atria. It's important to understand that both atria contract at the same time, while both ventricles contract at the same time. So as the atria contracts, the electrical pathway then moves down to here, which is the atrial ventricle node. This is on the very top part of the intraventricular septum. From the AV node, in atrial ventricle, the electrical pathway then travels down the septum in a pathway known as the bundle of His. Down the bundle of His, it spans around both ventricles at the same time through what's called the Purkinje fibers. This rhythmic stimulation of this contraction creates the ventricle contraction in itself. So again, the right atrium contracts at the same time, which push blood to the ventricles. Both ventricles rhythmically contract at the same time, in which the right ventricle pushes through the pulmonary artery, and the left ventricle pushes blood through the aortic arch and perfuses to the entire body. This is the electrical pathway that is happened in one single heartbeat. And our body produces a heartbeat on a normal rhythm of 60 to 100 beats per minute. So again, in a 10-second picture, which is what your standard ECG is, 12-lead ECG, from the SA node in what's known as the P wave on the ECG to the AV node, which travels through the bundle of His around the Purkinje fibers in the QRS complex that contracts the ventricles. And then the last wave that you will see on an ECG strip is the T wave, which is essentially the recovery and repolarization of the electrical pathway. All of this happens with every heartbeat. Hi, okay, so in this portion we're going to be reviewing the anatomy of the intercostal spaces and of the rib cage in which the leads are going to go. So if we move over to our poster here, we see, according to the American Heart Association, we have your ribs, your lungs, and your heart here in the middle behind the sternum, excuse me. So when we go down to V1, V2, it's important to understand that there are 10 on a normal ECG. Now there are different types of ECGs. On a 12-lead ECG strip, there are 10 leads that need to be placed. We have the right arm, which is indicated by a white marker, the right leg, which is indicated by a green marker, the left arm, which is indicated by a black marker, the left leg, which is indicated by a red marker. And then we go into our ventricle leads, V1, V2, V3, 4, 5, and 6, which are indicated by the colors as shown. So V1 is on the right side the sternum, and it is down on the fourth intercostal space. It is important to be able to palpate your intercostal spaces by the ribs. Understand that the intercostal space directly below the rib is what correlates them together. So first rib up here, go down to the first intercostal space, the second rib, second intercostal space, third rib, third intercostal space, fourth rib. Right in this inside of this intercostal space where V1 is going to lie. Just great rule of thumb, we never want to put a lead directly on a bone because of the density of the bone may interfere with the signal in which the leads pick up the electrical conduction. So V1 in the fourth intercostal space. V2 directly across the sternum, again, 1, 2, 3, 4, fourth intercostal space. V3 directly below, a little bit off to the side. V3 is sometimes placed on the bone as such. Again, if it can be avoided, great, but that one's okay per American Heart Association instructions. V4. V4 is in the fifth intercostal space, just one more down. V4 is also great. The gray marker is going to be the mid-clavicular line. Again, if you look at the patient's clavicle, this picture you can't really tell, but on the patient's clavicle, middle of the clavicle, mid-clavicular line is where V4 is generally going to be. V5, same intercostal space, fifth intercostal space, directly to the side of it, going more lateral to the left side of the patient. And V6 is going to be directly across from V5. V6 may go into the sixth intercostal space because of the way the anatomy of ribs curve. Whether it's V5 or V6, that's okay. What's mainly important, as shown here, is going to be mid-axillary line, meaning where your armpit is, full lateral transition, that is your axillary line. V6 will be there. All of these together measure the electrical conductivity that runs through the heart to be able to give you the clearest picture. Now this is a 12-lead ECG for diagnostic purposes. There are other ECGs, the 3-lead and the 5-lead, that are mostly used for general monitoring. A good way to see these pictures are understanding that each one of these leads, right arm, right leg, left arm, left leg, together gives you an angle, like a camera angle of how it is looking at the heart. An example would be from V6 to right arm is giving you from the mid-axillary position on the left side to the right arm lead. That angle is what we're looking at for that. V5 to right arm, left leg to left arm. That's one angle in itself. And it's how it measures this electrical conductivity to be able to determine where exactly on the heart could there be something going wrong.
So next we will be going over our supplies. You will need the following supplies: an ECG machine, some electrodes, leads, alcohol pads, gloves, and razors. This is the ECG machine. It is important to ensure that we do have an order from the provider before beginning. It is also important to ensure we have the correct patient and double check with 2 patient identifiers. Please make sure to perform proper hand hygiene and observe appropriate infection control procedures. At this time, we can introduce ourselves to the patient and properly explain the procedure to the patient. Reassure the patient that this procedure will not hurt. Provide the patient with privacy and make sure the patient is comfortable with the procedure. The patient may have to be exposed slightly. Now we can enter the proper patient identifiers into the ECG machine, as per facility policy. These are the leads. The leads are properly placed as described earlier. There's an acronym that we use to help. White on the right, snow over grass, so you have white over green, which is your right arm and right leg. Smoke over fire, which is black over red on your left arm and left leg. Then V1 to V6. The skin may need to be cleaned prior if oil or debris is present. Use alcohol for cleansing. If the patient has too much hair, the patient may need to be shaved.
Today we're doing a 12-lead electrocardiogram recording that is made from electrical activity in the heart muscle. We want to introduce self to patient and verify the patient's identity using two identifiers. Explain to the patient what you're going to do, why it is necessary, and how the patient can participate. Discuss how the results will be used in planning further care of treatments. We also want to reassure the patient that the machine will not cause discomfort or electrical shock.
Hello, ma'am. My name is Andres. One of the nurses here is my colleague, Tita. Just going to verify your name and date of birth for me. Okay, perfect. Mrs. Zalfar. We're going to be doing an ECG, and it's electrocardiogram. It's to measure the electrical impulses that run through your heart. It doesn't hurt. It's just a bunch of stickers on your chest and body, so I can use these leads to get my electrocardiogram done, right?
Now that the patient's been verified, we want to perform hand hygiene and observe appropriate infection control procedures. We also want to provide patient privacy, provide comfort and safety for patient and self, include raising the bed to appropriate height.
Close this curtain, give some privacy. Okay.
We're going to also attach leads to the patient's chest. In this process, we will assess chest for placement of electrodes. We're going to determine if the skin site care is necessary. If so, we're going to cleanse areas with a skin prep pad or alcohol swab, or clip hair if needed. We're also going to allow the area to dry thoroughly before placing electrodes. We will attach lead wires to electrodes before pressing onto the patient's chest. The rationale is that this prevents excess pressure, especially after open heart surgery or chest trauma. We will also check the color coding on the manufacturer's directions before placing electrodes to ensure they are correct. And when placing electrodes, we want to ensure lead wires are all going in the same direction. We will place electrodes on the fleshy areas, avoiding bone and muscle. This rationale is that this is to ensure good electrical conduction and clear ECG tracings. Now we will place the 4 limb leads, one on each limb or direction of the extremity, to the color coding.
Okay, man, we're going to have to expose you a little bit for this exam. Just going to lift up your gown here just for a couple of seconds. My colleague here is going to be placing the electrodes. I will be putting your information into my ECG machine, okay?
I'm just going to go ahead and clean you with some alcohol pads, okay? You're a little cold.
We will be placing the white lead on the right upper extremity, the green lead on the right lower extremity, the black lead on the left upper extremity, and finally the red lead on the left lower extremity. An acronym we use to remember is snow over grass and smoke over fire. Now, please remember that in order to be successful, we must palpate the intercostal spaces to place. Now, place the chest leads as follows. V1, which is placed in the 4th intercostal space and the right sternal border. V2 in the 4th intercostal space, the left sternal border. V3 to the right of V2 is between the 4th and 5th intercostal space. V4, the 5th intercostal space at the left mid-clavicular line. V5, the 5th intercostal space at the anterior axillary line. And V6, the fifth intercostal space, the left mid-axillary line. Once electrodes and leads are attached, ask patient to lie still for recording of ECG according to manufacturer's directions on the machine.
I'm just gonna have you lay down here for a little bit still, okay? Try not to move, buddy.
Okay, EKG is all done. We'll be removing the electrodes now, okay?
When we have the report, we'll be placing the tracing copy in the patient's chart, and when the procedure is complete, we will lower bed to the lowest position, perform hand hygiene, and leave patients safe and comfortable. Complete documentation using forms, checklists, or electrical drop-down lists supplemented by nurses' notes or additional comments as appropriate.
Okay, let's get you all covered up here. We're gonna go get the EKG to the doctor, put it in your chart. My doctor will be coming in here shortly to review the results with you. Let's get all this out of the way. Get your bed in lowest position. Make sure you have your call bell here. Warm hand hygiene. And this is all for now. Let us know if you need anything, okay, Ms. Doubtfire?